Climate change, every pore in this planet filled with poisons, our oceans and our whales and our fish filled with plastic. How do we make sense of this world? For many of us, it's through stories. And growing up in the country north of Montreal, many of the stories that I heard were from my dad. He was this natural storyteller. And some of my favorite memories were of us sitting there in the springtime in these old lawn chairs stuck in the snow. We'd be boiling sap over this fire. And I'd be asking him questions and we'd be sharing stories. What was it like growing up in the Depression? Tell me more about your mom and dad, my grandmother, my grandfather. What was it like to court my mom? It seemed that always the topic of the conversations would end up switching to his experiences in the war. His voice would get a little shaky, his breathing a little more rapid. And I learned what it was like to navigate through the darkness over Europe before there was radar, to be shot down, held in solitary confinement, and then to survive a concentration camp. To survive a camp where 50,000 people are led to their deaths in a gas chamber. How do you understand that? So when I look back at myself sitting there in my innocence, I know that these were important clues about the world, but more importantly, they were vital life lessons about living with humility and gratitude and forgiveness and leading with a loving heart. So I went to college. I graduated with an engineering degree. And not knowing what to do, like many, I threw on a backpack and headed off to Europe and ultimately ended up as a volunteer in Nicaragua, where I joined thousands of other young people from around the globe working to heal a country that had been ravaged by dictatorship and the exploitation by global corporations. And I can't remember I'm not sure if you can remember when you lost your innocence, but I remember it was there that I lost mine. It was with a Maryknoll nun, and it happened one evening. She was sharing her experiences of helping victims of torture. And I can't remember what she said, but I can't remember what was going on. But my whole brain started to shift, and it was as though I could physically feel pieces of it moving. And it was as though everything that made sense no longer did, and that everything I wanted to believe no longer was true. How could this craziness happen in this world? How could the world be so cruel? And how was I so lucky to be born in the skin, in a country and in a place when I was? I knew I had to do something, but I didn't know what. A few years later, I found my trajectory. I was working as an engineer on a project to reduce the discharge of persistent toxic chemicals into the Great Lakes. What we learned was that these chemicals contaminated and linked the entire web of life, and that some of the largest sources came from thousands of miles away, moving in the clouds, through the wind, dropping in the rain and the dust, meaning that if we wanted to have a local impact, we also had to work globally. And how the pristine environment did us this disservice by creating this illusion that all was well. How could we engage people in writing this tragedy when it was hidden from view? 5 years later, I was sitting in this room with some of the most caring, passionate people that I'd ever met. We were plotting and scheming on how we could transform the world by transforming healthcare. It was the beginning of Healthcare Without Harm. And as this tribe grew to be some of my dearest family, I learned important lessons. Through readings and poems, the importance of connecting to inner purpose, by gathering in circles and collaborating through networks, the importance of structure and relationships, and to a sense of shared ownership, the joy of co-creation. We are all co-creators of this incredible work. And of course, the on-the-ground work, the thrill when that light went off, when a nurse, a purchasing agent suddenly saw how they could be change agents for the world. Man, they come alive, and it's so exciting. But then the work got harder. The work on healthcare food made it clear that to transform healthcare food, we had to transform the global food system, that the part could not be disconnected from the whole, and that the whole was so economically powerful that healthcare couldn't do it by itself. And despite the stacks of scientific reports, the pie charts, the graphs explaining the pending global food system collapse, how could we engage people in a simple way and explain so that they can engage and not feel too overwhelmed? A large foundation hired communication experts and brought in focus groups to test and forge the message to help explain the problem. Our food system is like an out-of-control train, and unless it's brought under control, it's going to impact our children and future generations. The image of this powerful train speeding down the tracks in future generations was important. And these images work because they're tightly connected to how we believe the world works. Now, just think back centuries ago when this country was formed and grew, a time of scientific discovery, the Industrial Revolution, the Enlightenment. What we believed then became tightly woven into the fabric of this society, our judicial system, our political system, our medical system. And it's become our dominant narrative, our shared story that's so powerful and pervasive, we can't even see it. Back then, rational thought reigned supreme, giving us the belief in predictability and cause and effect, and this unwavering faith in science. We truly believed the world operated like a predictable machine. And now evolution reinforced these concepts of man over nature, of a hierarchy of human value, a hierarchy of all living beings, of individualism and competition. We believe in this infinite abundance, and that, I love this, the morality of men could be measured by their wealth. Together, these beliefs conspired to make this country one of the most powerful and wealthy in the world. And they're woven together in a story that's reinforced in the news and the media and the politics and exported all across the globe. It's become our dominant narrative, our shared story, despite everything slapping us in the face every day to the contrary. Just think. We're these loving, emotive, caring beings. We're this amalgam of mind and body and spirit. Social beings. We're wired for connection and relationship. We now know that we're more microbe than human cells that are linked and communicating from the soil through our gut to our brain, begging the question of who we are, what are we, and who's in control. The taking of our commons, our air, our water, our fish, our forests, is bringing into sharp focus that we live on a finite planet and that these are gifts. It's our shared legacy for future generations. The biggest irony is that modern science now explains that the only thing that's predictable is unpredictability. point is that our story, our collective story, is so incongruent with our reality that it no longer fits anymore. The emperor has no clothes. So what do we do when a story that's connected us for hundreds of years has died? Well, number one, we have to grieve. We're frozen, we deny, we're scared, we get angry. Look around us. We have to give ourselves permission to grieve. And for many of us, this started 20, 30, 40 years ago. Some of us more recently, and there's others desperately hanging on, hoping that this story can be kept alive. And number two, we have to listen with more than our ears. And this is probably the hardest task before us, because it asks us to be fully aware so that before we react, we can be deeply curious and sensing. And it requires vulnerability, not power. This stuff isn't taught in our schools and our culture. But it's what Luke Skywalker, right, in Star Wars had to learn, to be able to sense and to see with his eyes closed. And number three, as planetary citizens, we have to rewrite and create a story that's reflective of being fully alive on this crazy, beautiful, living planet. In many ways, what we're knitting together is an ancient story, first told by our shared ancestors. We're relearning ancient wisdom and ancient knowledge. But this stuff, what's really exciting, is this story is being written everywhere. And if we just stop and listen, we can see it bubbling up. And it's being written through the language of resilience and relationship and collaboration and holism and self-organization and shared ownership and the commons and agency. It's all around us. In Southeast Alaska, the indigenous Nuka system of care is creating these transformative health outcomes, applying the story. In the heart of the industrial food system, Food Commons Fresno is applying the story, building a community-owned food system from farm to fork. Our job is to call these models out, this new story, to invest in them and help them flourish within healthcare and out. We have to be curious, and we have to listen to our language so that we don't reinforce old patterns. If most of our health comes from outside of hospitals, why do we call a network of hospitals a health system? Why do many healthcare systems have these integrative or holistic centers as add-ons instead of the other way around? We're sitting on this divide, the great turning or teetering like a seesaw between an old paradigm and a new paradigm. And like my father navigating through the darkness, for many people, it is scary and it's terrifying without a clear way forward. I think our job is to do that outer work, but more importantly, perhaps, that inner work, so that we can shift the center of balance in using humility, gratitude, and loving hearts, that we can co-create a new story that works for all living beings. Thank you.